In this video, I wanted to take the time to answer the most common and frequent question I get every day on how someone can go about treating their injury on their own. In the video, I cover the following: determining if you're just in pain or injured, what are the components of an effective treatment, difference between maintenance versus treatment, why it's dangerous to listen to people on the internet who show you how to fix your injury, why it's impossible to treat your injury on your own, and what can you do to help in the healing process while getting treatment. For those of you who don't know me, my name is Dr. Matt Maggio. I am a soft tissue injury treatment expert. My focus is on diagnosing and treating adhesion, also known as scar tissue, and reducing inflammation from chronic injuries without the use of drugs, injections, or surgeries, which does lead to a significant increase in overall functioning, flexibility, and long lasting pain relief. Just a reminder, if you're dealing with chronic pain from an injury and struggling to get some real answers as to what is going on, you can submit your questions directly to me. And if my insights can help, I will be sure to get a video out to you. What can I do to treat my injury on my own? I get this question, I don't know, like 4 or 5 times a day. Every time I make a video in the comment section, it's always like, how can I fix this problem? I have this problem. I need to get it fixed. What can I do? What stretch can I do? What exercise can I do? Where can I jam a lacrosse ball in there? All this stuff. And it gets kind of frustrating sometimes, but I totally understand why people are doing it and why it's asked so much, because there's just so many morons on the internet. Anytime I scroll my social media feed or go through YouTube, I'm seeing all these people showing people how to diagnose, how to treat their injuries, how to fix their own problems. And it just blows my mind because they don't respect what's actually going on. So one thing you want to be able to understand is determining if you're just in pain or you're injured. There's a big difference in there. So when you're in pain, maybe you do a workout or maybe you walked longer than you normally do. Maybe your hip's a little more sore than it normally is. Maybe your shoulder's a little more beat up after a workout, but that pain does go away. When you're injured, typically these activities, they hurt all the time. They hurt when you do the activities. They hurt when you're not using the body part. They just hurt all the time and there's a lot of pain. So when you're actually injured, there's a lot more going on here. There are people that can help you get rid of some of the pain and soreness with some things and other activities that you can do yourself on your own. But when you're injured, all of those things just kind of go out in the trash because they're not going to get to the root cause of what's going on. One thing we always want to look about, and when I'm assessing something, trying to figure out the components of what's called an effective treatment, is it must be safe, it must be effective, and it must be durable. Basically, what that means is if you do the treatment, there shouldn't be a lot of side effects. Effective, yeah, it's going to help you maybe feel better, function better. But the key here is this component called durability. Is it long lasting? And when you're doing these things, these exercises, these stretches, these mobilizations, they're safe and effective temporarily, but they're not durable. They're not getting to the root cause of what's going on. So a big difference I always see with people is the difference between maintenance of injuries and actual treatment of injuries. So I think of the treatment part of the injury is almost like you have a cavity in your tooth that needs a very specific focused treatment from the dentist, maybe a drilling, maybe a root canal. Maintenance is more like brushing and flossing, maybe going to the hygienist and getting a deep clean. The thing is, when you're injured, it's like having a cavity. And when you have a cavity, all the brushing and flossing and cleaning that you do in the world isn't going to fix that problem. It's actually going to make it a lot worse. So you can't fix your injury directly on your own because it would be trying to fix your own cavity on your own. And imagine if there were people on the internet right now showing you how to drill your own tooth. We'd be like, those people are crazy, but there's so many people out there showing people how to fix their own injury. So why is it dangerous to listen to these people on the internet who show you how to fix your injury? What they do is they actually play a trick on the nervous system. When they play a trick on the nervous system, they temporarily get some things to relax and kind of chill out. And basically on your spinal cord, you have this pathway called the lateral spinal thalamic tract. And you have vibration and movement that goes up one part of it, and then you have pain that goes up the other. And a lot of times when you're doing an exercise, you're doing some type of stretch, you're doing some type of mobility, what you do is you get these mechanoreceptors to start firing, they start stimulating, they start going. And what it does is it blocks some of that pain. And then temporarily, you do feel better. but nothing actually improved. It's the same thing I say when your thumb gets stuck in a door, you pull it out and you start to shake it off. It's just blocking some of that pain. That's exactly what's happening when people are showing you these quick, instant relief, pain relief things for your injuries. They're actually setting you up for a bigger problem because a lot of times that pain is in there for a reason. It's trying to protect an underlying problem, maybe a damage to the joint, to the disc, to the cartilage, to the tendon. And you go in there and start to treat it or try to treat it, you're actually going to temporarily make it feel better, but you didn't fix anything. And any treatment that only improves symptoms but not function is actually dangerous. So why is it impossible to treat your injury on your own? Because over time, talk about this all the time, there's this stuff inside the muscle called adhesion that builds up. It's the most common cause of decreased flexibility, pain, and weakness in the body. It's like glue that gets inside the muscle. A lot of people also know it as scar tissue. Basically, over time, with bad postures, injuries, repetitive use, lack of movement, all sorts of things, the body develops this scar tissue adhesion. It gets inside the muscle, makes it weaker, less flexible. Eventually, it gets stuck to the nerve. When it gets stuck to the nerve, it causes problems. Then it puts more problems on the joint, the cartilage, the tendon, the disc, everything in there, and causes a lot of issues. Now, the thing is, in order to break down that adhesion, it needs proper depth and proper tension. So you do need a quality hands-on soft tissue person to go in there and fix it. And people get mad at me and they're like, well, I don't have the money. I don't have the resources to do it. Well, I don't know what to tell you. If you had a big gaping hole in your tooth and it was throbbing and hurting all the time, you'd find a way to get it fixed, or maybe you get the tooth taken out, but you'd still go to the dentist and do something about it. It's the same way with your injury. You're not going to be able to fix it on your own, no matter what anyone else tells you. So what can you do to help in the healing process while you're actually getting treatment? Number one is just proper load management. An injury in its most basic component on one side is what's called load, what you do, capacity is what you can take. It's like a teeter-totter. And basically what happens over time is when load exceeds capacity, that's when injuries happen. So a lot of times people that are injured, they're just doing too much and they don't have the capacity to actually be able to handle it. So cutting back on the load, maybe not doing as much weight, maybe not doing as much reps, maybe not going as far, giving that tissue a chance to heal and start to catch up. You know, a lot of people are like, if I can't work out, I'm going to die. I'm going to get fat. I'm going to lose my mind, all that stuff. That's not going to happen. It's a short-term reduction of load to help your capacity get better so you can eventually get back to doing the things you love. Because if you keep going down this path, it's going to get a lot worse. Next thing is just find an awesome soft tissue provider, and the best in the world specialize in adhesion treatment. And you can find one of those with all the information wherever you're consuming this. That's what we do. We have providers all over the world that specialize in diagnosing and treating adhesion, getting flexibility back, getting function back, and allowing for long-lasting pain relief so you can stay away from pain pills, injections, and surgeries, which only make things worse and definitely ruin people's lives. And lastly, just get the inflammation under control. Don't eat like crap. Don't be stressed. Exercise once in a while. Maybe drink some water. Be a normal human. So that's all I got in the video. Just in closing, don't get suckered into thinking an injury can be fully resolved on your own by some jackwagon on the internet making some content. There is always a window of opportunity to help solve the injury in a safe, effective, and durable way without having to resort to pain pills, injections, and surgeries, which, as I said earlier, only make things worse. But the longer you wait, the less likely a safer approach will be able to help. So if you're injured and in pain for, I'd say, at least this last 6 months, you've tried all the quick fixes promised online, you're still having issues, then reach out to us and request a no-charge injury consultation with an amazing soft tissue injury treatment provider in your area and take some action to getting the injury moving in the right direction instead of the wrong direction like it's been going. All of the information to do that is available wherever you're watching this video. I appreciate you watching, and we'll catch you on the next one. Bye.